this community briefing on our ongoing pandemic response efforts. Again, providing interpretation for us today is Margie Prop. Thank you, Margie, and thanks to everyone for joining us. There have been some new important developments related to COVID-19 vaccine for young children. Late last week, the Food and Drug Administration authorized both Pfizer and Moderna vaccine for children 5 and under. The Center for Disease and Control and Prevention gave its stamp of approval shortly after. We're here today to share some important information about vaccine for this age group. In Lancaster County, we have just over 23,000 children who are newly eligible to receive vaccine. These safe and effective vaccines can better protect them from severe illness from COVID-19 and help keep them healthy. COVID-19 is still here, and we continue to see the virus spreading in our community. We've received our Pfizer and Moderna vaccine shipments for this age group. We're in the process of distributing the vaccine, and it will be available soon through local pediatricians and family practice physicians. Joining us today is Dr. Sean Jones-Jobst, a pediatrician and president of Complete Children's Health in Lincoln. She'll touch on COVID-19's impact on children and what she's telling parents about vaccine for younger children. Thanks for being here, Doctor.
Thanks for having me, Director Lopez. I'm pretty excited to be here. We've been waiting for a while to have COVID-19 vaccination available for our youngest patients. And it's important because we know that COVID-19 complications, hospitalizations, and patients requiring ICU level care are higher in that youngest age group. And so although we've had vaccine available for quite some time now for our older pediatric patients, having vaccine available now for that 6-month through 5-year age group is actually quite important. The 6-month to 4-year age group is actually more likely to be hospitalized, more likely to require ICU level of care, and more likely to have ongoing complications from COVID-19. And so having this vaccine that we've actually had for quite some time available in that population is really a game changer for us in pediatrics. We have a lot of experience with this vaccine as well now. We've had it approved for the 12 and up age group since May of 2021, and for the 5 to 11-year-old age group since November of 2021. So this is not a new vaccine. It's been around for a while. In fact, over 600 million doses of COVID-19 vaccine have been given across the country, and almost 1 billion doses of mRNA COVID vaccine have been given across the world. If you count from the beginning of when the studies began on the COVID-19 mRNA vaccines, we've been giving this vaccine now for 2 years. And the studies show that it is safe and effective, most importantly in preventing complications and severe disease. And that's important in children, not necessarily because we see many deaths, although COVID-19 is one of the top 5 causes of death in young pediatric patients, but because it does cause hospitalizations and other complications like MIS-C, which is a complication post-COVID, and also long COVID. We now have enough data to be able to say that the vaccine helps to prevent those complications as well, and not just COVID-19 infection and hospitalization. And so we're at a great place to be able to offer this to our 6-month to 5-year age group. We do this time, it's a little bit different. This time we have 2 vaccines available for patients. And so we have, as Director Lopez said, we have the Moderna vaccine. We also have the Pfizer vaccine. The Moderna vaccine will be a 2-vaccine series given 4 weeks apart. Immunocompromised patients will require 3, with a second dose given 8 weeks after the third dose given 8 weeks after the second dose. The Pfizer vaccine will be a 3-dose series for both immunocompetent and immunocompromised pediatric patients, and that's given 3 weeks between the first and second dose and 8 weeks between the second and the third dose. So it'll take a little bit longer to get your Pfizer vaccine in, but like I said, we have great experience and long period of time of experience with these vaccines, knowing that they're safe and effective. The side effect profile was mild. We did see fever, fatigue, some soreness at the injection site in the study group between 6 months and 5 years of age. Those are expected side effects that we often see with vaccines, and so that's not surprising. We also saw in the studies that the antibody levels and the level of protection was similar to what we saw with the adult vaccines against the Omicron variant. And so we expect it to be quite effective and able to protect our pediatric patients as well as it's protecting the adults as well. So antibody levels actually with these vaccines in the younger age group were equivalent to, if not a little bit better, than the 18 to 25-year-old age group with their vaccine, which showed the strongest antibody response to the vaccine. So this is an exciting time in pediatrics. I will say I've had a lot of parents ask me the question, which vaccine should my child get if there's an opportunity to get one or the other? And it's really hard to compare those vaccines back to back right now. They're a different schedule, and because of that, they were given over a different time period and had different numbers of cases in the studies. The Moderna vaccine was during the height of the Omicron outbreak, and so we saw a lot of cases in that study, fewer cases over the course of the Pfizer vaccine study. So there isn't really a head-to-head comparison. The best vaccine for your child is going to be the vaccine that you can get into your child safely at either your pediatrician's office, your family medicine office, a pharmacy if your child is over 3 years of age and it's available to them, or at the public health department. So I'll be happy to take any questions at the end.
Thank you for that valuable information, and we really appreciate our partnership with Complete Children's Health and all our other pediatric and family practice offices in our community, especially even our entire medical community has been phenomenal in their response and support and guidance to us. And as a community, we really owe them a sincere thank you. We're excited to continue to work together to now offer COVID-19 vaccine to younger children. In the pediatric or family practice setting, parents can have a candid conversation with their children's healthcare provider about COVID-19 vaccine and any questions they may have. This helps them get the information they need to make the best choices for their child. For more information about how and when your child's medical home will be providing vaccine to younger patients, we encourage you to go to the clinic's websites or social media sites. They have the fastest answers and the most up-to-date answers for you. The health department will also be offering COVID-19 vaccine to younger children. We're currently finalizing dates and locations for upcoming clinics, and we'll share more details as those are confirmed. In the meantime, parents and guardians can register through covid19.lincoln.ne.gov or by calling us at the health department at 402-441-4200. And we'll notify them as soon as they can schedule an appointment. Several pharmacies are also offering vaccine to younger children by appointment. You can contact the pharmacy or go to vaccines.gov to check availability. Vaccinations are critical in preventing many childhood diseases like chickenpox, flu, measles, mumps, polio, and whooping cough. As I mentioned, COVID-19 vaccine is another safe and effective vaccine that will help protect children and keep them healthy. Vaccinating children can also protect family members who may be at increased risk of getting very sick if they should get COVID-19. The COVID-19 vaccine is now essentially available to everyone from older adults to younger children. The primary series is available to those 6 months and older. The first booster doses are available to everyone 5 and older, and a second booster dose is available for those 50 and older and those 12 and older that are immunocompromised. If children are eligible for COVID vaccine, please get them vaccinated. If they have not yet received their booster, we also strongly encourage parents to get them vaccinated as soon as possible so they can benefit from the protection that vaccines provide. Just before the press conference, we learned one more development on the vaccine front. CDC's advisory committee has endorsed Moderna's COVID vaccine for children 6 to 17. A final decision from CDC's director is expected soon. And with that, I'd be happy to take any questions.
In doctors' offices and pharmacies, will the vaccine also be available at public clinics?
We're in the process of scheduling those, and actually, people can start registering at the health department. We'll notify them as soon as we have the clinic appointments available. We will be giving the vaccines at the health department, and we're working on other distribution methods. But just so you know, because of this particular age group, we're not going to have a vaccine clinic, if that's what people are asking, like at Pinnacle Bank Arena or in the schools or not. That's just not an appropriate setting to meet the needs of these very young children.
Is the online scheduling for individual private doctors only, or also for public clinics such as those offered at the health department?
Okay, so the online scheduling for the number I gave you is for the health department. If we make any changes and we have a community small clinic, we'll also have you schedule through there. But otherwise, if you're not scheduling to come there, you need to go to your physician's office website or their social media and see how they're directing you to schedule for your appointment. And I encourage you to go to those sites. We've talked with the physicians. They're going to keep those sites, their offices will keep those up to date. And that's the fastest way for you to get information. And it also assures that we don't overwhelm those offices with phone calls when they're trying to take care of other possibly critically ill patients. So just go to their website and use social media from their sites to do it. If you have questions and you need direction and you're not sure, please just don't hesitate to call us at that number I gave you, the 402-441-4200. We have staff specifically there to answer questions and help people. So we don't want you to be frustrated, and we want you to get the information you need, and we want to do that in the best possible way for everyone. Anything else? Matt, are you trying to talk? No?
We will not offer large-scale clinics, but it will be available at the health department.
Okay. All right, thanks for joining us today. We appreciate it, and we'll be getting more information out to you very soon.